Chronicles now transmitting.
Welcome to the Tate Chronicles on Healthcare Now Radio. And now, here's your host, Jim Tate.
Good day, citizens of the free world, from border to border, coast to coast, and to all the ships at sea. I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning in today to the Tate Chronicles. Join me as we cut through the fog that exists at the leading edge of healthcare technology and healthcare process. I'm really excited today. My guest is Angie Franks. Angie is the CEO of Central Logic. She spent 30 years in the healthcare technology space and has held leadership positions with quite a few prominent healthcare firms, such as the Advisory Board Company, Lawson Software, Healthland, and GeoAccess. Angie, thanks so much for coming aboard today with me.
Thanks, Jim. It's great to be here.
You know, one of the first things I want to touch on is it appears there is a critical need now more than ever for health systems not to rely on a static approach to how they deliver health care in a sustainable manner. And there's some predictability in change, like changes in demographic trends that healthcare systems need to be mindful of. But then we have these sudden events like COVID-19 dropping out of the sky. And so it appears to me, and it seems like the work that you're involved in is to get those healthcare leaders to have a deep understanding of all the issues that is paramount. And so if you would first, can you provide some information on the services you provide at Central Logic and what type of customers you have?
Absolutely. Be happy to. Central Logic was really founded to solve the problem of acute interfacility patient transfers. And that is, you've got sick patient in a hospital or in a clinic setting that needs to get to a certain type of care or needs to get to another hospital that has more capacity in order to care for that patient, and they need to do so in a very timely manner. Central Logic was founded by building a technology platform to help take the friction out of that acute referral process and get the patient to the right location for the care that they need in a very timely manner. And as COVID has certainly illuminated the problems that we have in this regard, it's just shed a light on the fact that orchestrating and navigating patients to the optimal setting of care is a logistical nightmare, and hospitals don't have, even across their own systems, they don't have technology that helps enable that business process very easily, and that's the problem that we solve. So, yeah.
Could you give me some anecdotal details of, let's just take maybe a patient who's, let's say, is in a regular hospital or and needs to be transferred to an acute care facility or a COVID-specific facility. What does Central Logic do to remove some of that friction?
Yeah, I'll give a great example, maybe a pre-COVID and then a COVID-based example to make it a little more clear what we do. Pre-COVID, one of our founders is a physician, and he tells this story about kind of the straw that broke the camel's back when he really realized something had to be done. And that was, he was treating a patient. He was a hospitalist in a community hospital in Utah. He had a patient in front of him that was clearly having a significant cardiac event. And his diagnosis was that he thought this patient was having a dissecting aorta. And at his facility, they did not have the capabilities to treat that condition. So he needed to find a place to transfer that patient to that had that type of cardiac care. Now, you could imagine a dissecting aorta is it's a time-sensitive manner. We've got to get this person to the right location quickly. You cannot put the patient on an ambulance, call 911 and stick him in an ambulance when the patient's under a physician's care. That is, you've got to facilitate and broker the transfer. So Darren had to, start making phone calls, calling other hospitals in the area that had that type of advanced cardiac care, wait for calls back until somebody finally agreed that they had the capacity, they had a physician, they had the availability to take that patient, and then Darren could order and execute the transport and move the patient from point A to point B. That process took him just under 3 hours. Meanwhile, the patient is, decompensating in front of him. So you've got a situation where it takes 3 hours to get somebody to say yes, a series of phone calls. The patient is getting worse by the minute, and it's because there wasn't a good process in place to orchestrate this. Hospitals, have traditionally not built functions to make it easy to move patients into their health systems. So Darren set out, this is, about 2010, to solve that problem, and that's how Central Logic was founded. So that's a great use case and example in a pre-COVID world. Take what happened with, so fast forward to 2020, we've got New York blowing up with COVID cases, and you've got patients flooding into the emergency departments where they are so backed up with demand that they can't get through to triage these patients and get them into beds and get them to the right facilities. And we're seeing one hospital overloaded with demand, and other facilities, whether it was the USS Comfort or, another hospital down the road, with open and empty beds that wasn't experiencing that same demand. In that use case, we as a healthcare system had no way of orchestrating and coordinating that demand and balancing it out across all the facilities, meaning we've got too much demand at one hospital. Let's start shifting these patients to this open facility and filling those beds up. Central Logic provides a technology platform and the real-time visibility to see all of the available capacity and make those placement decisions and route those patients to a facility where they can have access to care. And we did this in the state of Arizona during this COVID pandemic, and they were able to pull together, and this is what Central Logic did working with the state of Arizona, was we pulled all of the available hospital capacity, so all beds across the state, all ventilator capacity, all critical care capacity, so that no one hospital or health system became overridden with demand. That when they were filling up and they had, one hospital had too many patients, or they were just getting to the point where they were reaching maximum capacity, the state would make those decisions as to where to start transferring people, and thus load balance and utilize all of the capacity of the state to take care of the COVID spikes and the surge increases that came along with it. And as a result, they've had phenomenal, much better results in terms of the number of patient transfers, the balancing of beds and capacity across the state, even down to, comparatively their mortality rate compared to New York City. So that's kind of the post-COVID example of what we do.
I understand that, Angie. It sounds like it's a process, software and process that helps balance the load, because you see where the opportunities are to shift resources and where there are resources available.
Yeah, what we really come in to do is we come in with those best practices, how you need to operate this function, all of the workflow and the processes, and then we put the technology in place to enable that.
In the use case in Arizona, you're talking about, were y'all already in place, or because of COVID, you were brought in suddenly to help that situation?
Yeah, great question. So in Arizona, we were already doing this for Banner Health System. So large hospitals and health systems use Central Logic, and they use us across their entire enterprise. So they will utilize all the capacity inside their own health system and load balance. And so we were already solving this problem for Banner. And Banner is the largest health system in Arizona. So about 50% of the beds were Banner beds. The governor of Arizona tapped Banner and said, look, this is what we want to do. Here's the vision through the Department of Health. And we want to work with Banner to help us do this. And Banner took one of their executives, and really that executive worked for the Department of Health for a month early on in COVID. So late March to the end of April to put this in place. And the Banner executive said, we already have a whole technology platform and processes to do this. We want to bring our partner with us. And so we were brought in with Banner's leadership and then worked directly with the state to put this in place.
And in that case, does each facility have access to an online dashboard that gives them that real-time options where resources are and aren't?
Yeah. So what we did was each hospital and health system, they have their own processes for handling and facilitating transfers. What they would do is their data was being fed into a real-time dashboard that we created at the state level, at the Department of Health, so that when any facility was starting to get filled up, they would notify, there was an alert to the state, and when more demand was coming in for COVID beds in that area or to that health system, the state would take over and find the best bed, the best location for that patient to go, and then they would facilitate getting that patient moved to the appropriate facility.
You know, we're talking about the actual delivery of healthcare. There's another thing I'd like to maybe take a step or two back, Angie, and just ask your opinion on. An example of the COVID-19 pandemic, established business processes and business models of healthcare systems hit a brick wall. And many hospitals were at the point of, well, not the point of financial crisis, they were in financial crisis. During those months, what did you see the effects that was having on hospitals, and how have some of them been able to adjust, you know, as far as best practices and lessons learned now
Sure.
and going forward?
Sure. I don't think any of us could have ever imagined a day in our careers or in our lifetime where we would see hospitals have to shut down and stop offering services because of a shortage of PPE and equipment, and a need to conserve that equipment for some impending demand and patient surge. But that's exactly what happened with COVID. Was hospitals had to really shut off all of their revenue streams while they waited for the patient surge to come, and they conserved supplies for that surge. And as a result, you know, we had hospitals losing literally millions of dollars a day. And they're, you know, these aren't health systems, as you know, are not, they don't have large margins to absorb that type of revenue loss. And so financially, it's been devastating for hospital systems. I think the CARES Act funding and the dollars that have come in from the federal level have helped offset some of that, but hospitals really had to start shifting their attention this summer as we got into later Q2 and early Q3 into kind of a restart mode and get patients flowing back into the health systems and get people utilizing their services. And so that was a new problem for our industry, was to be able to really start driving more demand and, you know, communicating to their communities. We're open for business, and, you know, start getting patients moving into their systems. What I hear from our customers and others across the industry is that patient volumes are rebounding, and they might not be back to the full levels that they were prior to COVID. So they're still down, but there are differences in the way that volume is rebounding. Some of the more valuable service lines and more, you know, what they were used to seeing with cardiac and neuro, and some of those service lines maybe have not rebounded as much as they expect that they should. And I think hospitals are now starting to look at what are their strategies for growth? What are the strategies for getting those patients referred back into their systems and getting those service lines flowing again like they were prior to COVID. And that now takes a work effort because that business process was disrupted.
It was at least a couple of months there when all elective procedures were canceled.
Right.
But the fixed cost of running a hospital was not canceled. There's a lot of different aspects of this. One is essentially there was 3 or 4 months of delayed health care for chronic disease or elective procedures, whether it's a hip replacement or something like that.
That's right.
And so, at some point, either the care will not be given, just be missed, or it's going to be delayed. But the thing that you mentioned, Angie, is that it seems like it gives hospitals an opportunity with the kind of work that you provide at Central Logic to identify those service lines, as you call them, I guess specialty service lines, and see which ones continue to be appropriate for them and which ones maybe don't. Is that the kind of support analysis you do also?
Right. So one of the most valuable aspects of our solution is really the data that comes out of our system when hospitals are using when they've invested in a transfer and an access center, and they're really making it very easy for referring physicians and other facilities to send patients to their organization. The data that gets captured through that process is really valuable for strategic planning and understanding service line growth, revenue strategies, where your referrals coming from, who was referring patients to you, and that referral pattern changed. It either dropped or it picked up. And where are there areas where you're not getting those referrals, those cardiac cases or those neuro cases or those ortho cases, whatever service lines are important for a particular health system, they've got to put the strategies in place to really do that business development work and reach out to those referring providers and make it easy and safe and comfortable for those referring providers to send patients into their health system. And that's really a big part of what we enable. And then the data that comes out of that tells you what the results, what those referral patterns look like, and allow the health system to go out and target those areas where maybe they're not getting the referrals that they expected, or there's been a change in the referral pattern, and they can understand why, and what they can do to improve to get those numbers back up. So it really is part of a broader growth and revenue and business development strategy. It also is about aligning, when those patient referrals come in for different service lines, you want to make sure that you're putting that patient in the most appropriate facility. So you're not putting a patient that doesn't need to be in the level 1 trauma center. Don't put the patient with lower acuity in the most expensive facility. These health systems have lots of venues for care, and sometimes not everybody needs to go to the level 1. We see this very common problem. The flagship hospital becomes the place where all referred patients get sent to. And what ends up happening is the flagship is now filled. They're not filled with the appropriate level of acuity patients, and they have other facilities sitting there at 48% occupancy, and they could have been leveraging their capacity more effectively and better aligning the revenue for those patients with the costs of that facility. And so it is an exercise in operational effectiveness and logistics and planning. And the outcome is it's a better experience for the patient. It's easier for the provider that's making that referral, and it has a financial impact for the hospital to their bottom line.
Angie, hospital and healthcare systems coming out of the pandemic crisis, I guess we're coming out of it, or hopefully we're through the worst of it as far as hospitals having to essentially shut down their normal business of taking care of patients, acute and chronic and elective. Hopefully we're past that point. We're not going to go back to it. But it seems like that the leaders of those systems have the opportunity to take advantage of lessons learned and identify some new opportunities to do things in a different way.
Right.
Maybe that had been put off, but this is a perfect opportunity. And it sounds like these, measuring the success of these specialty centers, it's a very appropriate time to do that.
Yeah, it really, I think that if there is a silver lining from this pandemic, it is first, we were able to identify inefficiencies and issues, barriers that we have in coordination of care for across our health systems in the case of a surge. So I think we've learned a lot as a health system. But I think maybe the bigger silver lining in all of this is COVID has served as a catalyst or an accelerant to change that has been in the works for a long time. Things that we've been doing. I'll take telemedicine as a perfect example. I think telemedicine has been around for a long time, but there were a lot of barriers for utilizing telemedicine. And in the case of what we're just talking about here with patient transfers, not every patient has to be moved. Sometimes the best situation for that patient is to really transfer the patient to a telemedicine visit and have them stay in the facility that they're in and have a specialist via telemedicine see that and treat that patient. Well, we had so many barriers for telemedicine adoption, from the way it is reimbursed to some of the disparities in reimbursement, to the ability to practice across state lines and licensure issues. But all of those barriers came down with COVID. The laws were changed and adjusted because we needed to utilize our resources differently. And I think that has been a real positive for healthcare, as it has opened up the possibility of doing things differently, doing things more efficiently, taking advantage of progress that we were making, albeit over the last 5 to 10 years, and really accelerating adoption of new ways of doing things. And I think that's great. I think that it is certainly a new day for all of us in healthcare, and there's a lot that we need to figure out in terms of our operations and getting back our financial models and getting back to more of a normalcy in terms of our revenue and our expense picture. But this pandemic has accelerated the adoption of technologies and ideas that were in the works for a long time that now can be part of our new normal.
Well, there's two things you mentioned there, Angie. One is the telehealth. That's not new technology. It's been around. It has just been, I don't know whether to call it underutilized, but it hadn't been utilized very much. And all of a sudden, there was an overwhelming need, and everybody learned in healthcare, or a vast number of providers learned to use it very quickly. A lot of patients learned to use it very quickly.
Right.
And so whether it's just those face-to-face encounters or it is telehealth with remote patient monitoring, I think the needle has definitely moved because of the pandemic.
Absolutely right. And patients love it. I mean, the patients love the convenience and the access. The physicians were getting reimbursed for their time. It freed up more capacity in our system to take care of people. Your mentioning of remote patient monitoring. I mean, what a fantastic way for the patients with chronic disease to be in their home and to be monitored by clinicians who can oversee their care, oversee the panels of care for hundreds, if not thousands of patients simultaneously. And, with some of the technology that we've been talking about here from Central Logic, we can we can integrate with that technology and take action when patients need to go from that telehealth visit or that remote monitoring visit into an actual appointment, or get them in the door to see somebody face to face because their condition demands it. All of those logistics on orchestrating that care and getting the patient to the care that they need is where we come in. And so the acceleration of adopting those types of technologies and care delivery models is, I think, really exciting for healthcare and for our future.
Angie, I can't believe it, but we're almost out of time here before the clock runs out. Tell our listeners how they can find out more about Central Logic services and how to contact Central Logic.
Well, absolutely. I would advise people to go to our website, www.centrallogic.com, or call our office at 801-987-9090, and we would love to help out your listeners.
Well, to our audience, thanks for joining me on this episode of the Tate Chronicles. I offer a special salute to my guest today, Angie Franks of Central Logic. Angie, thanks for coming aboard today.
Thank you so much, Jim. It was absolutely a pleasure to be here with you.
I enjoyed it also. You can find more information on this show's program page at healthcarenowradio.com. And until we meet again, here's wishing you smooth sailing and safe harbors.
Tate Chronicles transmission ending now.